Hello everyone and welcome to the Navin Times Talk from the Heart. With better living conditions and healthcare, today we have a bigger life expectancy. While being able to reach old age is something to be thankful for, there are many challenges that the elderly face. Most often what happens is we don't realize or we are not aware of these challenges. And it is only as we are reaching old age or we see a family member struggling with the problems of old age that we sit up and actually take notice. As a society, we all need to do something to make this phase in the life of people easier. Our guest today is a psychiatrist and Director of Cooj Mental Health Services, Dr. Peter Castellino.
Yes, hello.
Hello, Doctor, and thank you for coming on our show. It's such a pleasure to have you because we have so much to talk about. Doctor, tell us a little bit about yourself. I have said that you are a psychiatrist and the founder of, Director of Cooj. Can you tell us a little bit more about yourself?
Okay. So I'm a psychiatrist, as you mentioned, and I remember more than 20 years back when I was a resident at the psychiatric hospital, I realized something very important, that most of the treatments that were given were medical, pharmacological, and very little treatments were towards improving the psychosocial well-being of a person. And I saw a lot of my patients living in the hospital there for years, 15 years, 20 years, 30 years. And even if I tried to take them out, their skills were so poor that they were not able to relate into the normal environment. And that's when I said...
So connect back to once they come out, is that what you're saying?
Yeah, they were not able to, because their skills, social skills, or just the skills of living a normal life were kind of not really, they were not equipped to deal with this kind of a normal life, and because they were living in that, in the hospital for years. And that's when I realized that what we needed was to have these psychosocial interventions for people with long-standing illnesses, so that besides medication, they can then develop the skills to live a normal life. And that's when the idea of Cooj came around, and it was at that time when I met our foundress. So together we set up Cooj, and it has been a journey.
So how long ago was this, Doctor?
This was in exactly 20 years back, and we're actually observing our 20 years this year.
Congratulations from all of us watching.
Thank you.
I'm sure you will join me in congratulating not just Doctor but all the members of Cooj.
The entire team, yes. Thank you. Thank you. Yeah, and we thought like, okay, and the first learning that we had was that, wow, there's so many patients with a severe mental illness, and so there would be like a lineup for our services. But unfortunately, this was not the fact. We had to wait for almost 6 months to get our first patient, and that was a time of introspection and learnings. And then we realized that the stigma was very high. There was a lack of awareness of mental illness and of what we were trying to do. And so we used that time to actually go out and educate people. And that was one of the best times that we had, because we learned so much. We learned from the community, we learned from families, we learned from patients, we learned their needs. And and then 6 months later we had our first client, and then it started growing, and then it just multiplied, and so that was a very interesting journey for us. Yes.
Today Cooj is considered a real helping hand. I'm sure you have heard of Cooj, and especially their suicide prevention helpline. So besides suicide prevention, is that what you started with? Suicide prevention?
No. As I mentioned, we started off with the rehabilitation services for people with the mental illness. So that was, we started off with actually with women, and then we went on to a more generic, for both men and women in 2004, when we formalized our program. And we started our suicide prevention program much later, actually in 2012.
Okay.
Yeah, in 2012, and that's because we recognized that the rate of suicide in Goa was much higher than the national average, and we said we need to do something. And that's when that program came up in 2012. It was in 2014 that we set up the geriatric and dementia care unit, and it was very interesting how we set this up.
We all love stories. I'm sure everyone watching loves stories. I do. So let's hear it from you. How did it happen?
So as a psychiatrist, I have been called to many senior homes.
Right.
Because someone over there, an elderly, is possibly going through some kind of a mental health problem. And when I would visit these homes, I realized that though there were a lot of people who were diagnosed with depression, I won't say diagnosed with depression, but were having depressive symptoms, they were actually not depressed. They were facing loneliness. And then when we began to dig deeper, we realized that either they were coming out from these huge families, but then the nuclear family system came out and started developing, emerging. Then their kids migrated, and so more and more they began to have lesser family contacts, lesser social contacts. Then they were placed in old age homes because there was no one to care for them. And in the homes, if you see, their physical needs are met. Their needs of medication, their food, their shelter, their, just the whole regular routine of life is met. But their emotional needs were not met. Because, I don't blame the homes. It's just that they don't have that much of staffing to look after both the physical, medical, as well as the emotional needs.
Not just the staffing. I think the resources. It is expensive.
It's not very expensive, and that's one thing. Just to look after you just need to get two people together to play a game of cards, or you just need to get people to sing together. Simple things, but these structures were not in place because the caregivers in the home did not have time to plan that and ensure that is happening. Because even to ensure that they all come together and have a sing-song needs
a lot of planning.
One is planning, but also needs to motivate some of the elderly who are now so complacent and very happy just sitting down, So to get them together, get them into groups, that needed a little bit of energy and time and motivation. And so we saw that was lacking. And that's when I realized, let's start at a more preventive step where we can actually develop systems within the senior homes, where we build capacity, where we understand that they lack resources, but there are resources in the community. There are lots of people willing to volunteer. So get the volunteers into the homes, formulate, we will teach them what needs to be done. So we set up these 8-month programs in every senior, in homes that were willing to have us in, where we build capacity, and what we would do is twice a week we would have programs for the seniors. And initially there was resistance because they're so happy just lying down and doing nothing. But then when they began to engage themselves, and we would sing songs, and they love to, you can sing K Sera Sera 100 times and they'll still enjoy it.
I know, I agree.
The old songs, and so just structuring simple elements into a program, playing cards, playing games, darts, throwing the ball, a little bit of dance, and for those who cannot dance, movement, and what we began to see is that now the elders began to look forward to us coming. We began to see that now there was a smile on their faces when we entered, they were all prepared and ready for the program. That shift for us was tremendous, and that's how we started our program. Then we began to have little tea parties for them. See, what happens is a lot of people go to senior citizen homes, they'll sing a song, they'll serve snacks. We feel very happy, they feel a little happy for that moment, but by the time we go, they actually gone flat.
Yes.
So we realized that they needed to have a sense of control. They needed to dress up. So we would have little tea parties where they would dress up. We'd make sure that the women painted their nails and, wore little makeup, and they got ready for these little tea parties, these functions. And then we began to have the carnival for senior citizens once a year.
Oh God, that's interesting. I hope you're listening.
Yeah, where we almost 300 to 400 seniors from around 20 old age homes, we would bring them to the Emerald Lawns, and the owner of Emerald Lawns was very kind to allow us to use his space. And so once a year for almost, I think, 6 or 7 years we've had this. And even this year with the pandemic we still had it, but this time we didn't get them all in one venue, but we went to individual homes that allowed us to enter, and we used all the precautions.
Of course.
But again, people had fun. So that was how we started off the geriatric program.
So besides the geriatric program and the suicide prevention helpline, what are the other services that Coach
Yeah, so I said we
offers?
have the rehabilitation program, then we have counseling, we have community programs where we go into the communities, we have camps, we have mental illness detection camps, because we realize so many people don't even know that they have a problem. So we have the screening, and we can't just go into a community and start screening for mental illnesses.
Yes.
They would
Nobody will come.
So what we normally do is, in the disguise of having a general medical camp, we kind of screen everyone for a mental health problem, and we realize that there are so many people who
don't even
know,
realize.
and they've been going to doctors for years. They've been going to general physicians with complaints of headaches and body pains and aches and just general weakness, sleep disturbance, loss of appetite, and they're getting just vitamins and painkillers and tonics. But the main problem was actually depression. It was anxiety, which was not really diagnosed. So and our main thing is to create awareness in the community that there is something called mental illness, there is something called mental health, and we need to recognize if you're tipping off from mental health into mental illness, and there is help available. Yeah.
So now we come to, you had earlier said, and I'm sure you agree with me, that some of the reasons why the elderly feel very marginalized, the care that they need is not given to them. Some of the reasons doctor has already mentioned, that migration, that people are migrating for whatever reason, better life, better salary, whatever. Then because of nuclear families. What are some of the other reasons, doctor, besides these two? And of course, we are adopting the Western lifestyle, and according to that, we keep our elderly separate. So what other reasons, doctor, are there that we are not able to give the elderly the care that they should be getting?
So, I mean, it's very complex. It's very complex. Now, if you look at the elderly, we need to know that there are a lot of issues which come in with aging. It can be physical incapacitation, it can be emotional issues that come in, and if we are unable to meet those needs, it becomes difficult. Now again, as I said, with caregiving, initially seniors lived in a larger home, and there were a lot more people now to look after.
The support system was
larger.
Broader and larger.
Now
yes.
It's much smaller, and you see the person who has to take care of them already has other roles to play, and now to play a full-time caregiver also is very challenging for the caregiver. It's easy to push the blame onto a caregiver, but it is very challenging.
It is.
For
I
a
agree
normal
with you.
caregiver. Now if someone if an elderly has a mental illness, maybe it's depression or maybe it is dementia, the burden of care is huge.
It is.
And I find it's not that caregivers don't want to care, but first of all, they're not trained in how to care. And they have to, there is the time constraints, there's so much to do. So it is very, very difficult. And that's what we are trying to hope, that there would be more care centers, that there would be more respite for caregivers, that if they need to take a break, that there would be someone to pitch in. Because caregiver burden is huge, and this burden of care, this burden on caregivers leads to their own mental health being compromised.
Absolutely.
Burnout is huge. They're just so tired, they're just so exhausted, and from that, when someone keeps repeating again and again the same thing, naturally irritation comes up, and you flare up, and you say, just shut up. So when we're looking at treatment, the holistic package of treating someone, say with dementia, we are also looking at how we can help caregivers, we can support caregivers, because caregiver burnout has been researched and studied, is a direct link to some of the symptoms of dementia to flare up, especially when they get aggressive, when they get anxious, when they're getting worried, when they're getting stubborn. Sometimes it is because of the way they have been treated, but the way they have been treated is because of burnout. So there are many elements involved.
So everything is
kind of linked.
We are all linked, and these problems too are linked. And you spoke about physical problems. We know that the sick, the elderly, have physical problem, not being able to move, doing things on their own. Besides the physical problems, the mental problems you've also mentioned, are they emotionally also facing a lot of problems?
Yeah, so as I've mentioned, I've not mentioned, but if you look at the whole range of mental illnesses that affect elderlies, it is almost 20% on an average. So 1 out of every 5 elderly has a mental health issue, a mental illness. But what we're also trying to tell you is that 4 out of those 5 are healthy. Are not having mental problems. Not having a mental health problem. So what we need to know is, if someone has a behavioral issue, or someone is forgetting more than that is usual, or someone is feeling not getting sleep, or getting disturbed, or very anxious, very irritable, I think we need to take this seriously, and I think we need to seek help. We need to get an assessment done, because there are assessments, and sometimes they're very simple assessments, but we need to do it. We cannot just take every problem to be part of normal aging, because a lot of times people could have a problem, especially with the pandemic, and the normal methods that we use to cope with our issues were actually curtailed for everyone, and more so for the elderly, because they were coming under the vulnerable group. So at least we would go to the market and buy something, come on, I would still go to work. But for them, they were just kept at home because they were part of the vulnerable group. And so those who were at home used at least social media to connect with the world. But a lot of elderlies did not have their own devices. All their devices were shared among everyone in the family. Kids had to use the device for school. The others had to use it for work. And so they did not have a device, or they had a device, they did not know how to use it. So the digital divide also prevented them from connecting with their seniors. So at Cooj, we run a senior therapy center, where initially I said we used to go to old age homes, but now we have a full-fledged therapeutic center where seniors can come to our center 3 times a week. In case they cannot come now with the pandemic, we connect with them digitally. But again, a lot of dropouts because people do not have their device, or did not know how to use a device. So if we had a Zoom meeting, it was so difficult for them.
Exactly.
So we had to connect either on WhatsApp, or again, many of them, because of connectivity issues or not knowing how to use WhatsApp, we had to just do it on a simple phone call. We kind of connected with them.
So that makes it more difficult, because when you are doing it in a group, it becomes easier for you.
It becomes...
And also, according to me, correct me if I'm wrong, that the people who are participating, the participants also feel that connect with other people. So when they are in a group, it's so much better, isn't it?
Exactly. So see, what helps anyone is to have the social contact. And what we have seen at our centers is that just the whole exercise of dressing up in the morning, coming out, being with other people, and we start off the day with basic exercises. That makes a world of a difference. The sense of worth, the sense of self-respect, self-dignity becomes preserved. And we have activities, and some of the activities are very simple, but you ask them to do it at home, they will not do it. I'm a child, to make me draw. But here, since all of us are pitching in, they don't feel that they are the only one doing that. Everyone is doing. So we help to maintain their skills. So depending on the level of skills, we kind of have activities at our senior center, and we've realized that a lot of the mild problems get sorted out by these kind of activities, number one. Number two, these activities also help to exercise the brain, to preserve something called neuroplasticity, where again the decline in functioning is kind of delayed, or if the decline is already begin to be seen, again it gets postponed, or there is some kind of improvement that takes place, because the emotional needs also get met in a system and a therapeutic environment like this.
In a group.
Yes.
Which works better, doctor? Which works better according to you? Someone who a patient of yours who wants to sit and talk to you one-to-one, or according to you, is it better if they are in a group?
It's both. I mean, there's a place for group therapy, there's a place for individual therapy. I mean, some of my most innermost problems, I'm not going to share it in a group. So there is a place for one-on-one personal therapy, and there is a place for group therapy, and in our centers we offer both. Again, it depends on the need of every client that comes in, and as I said, the needs can be varied.
Okay.
And also I said that we run the geriatric and dementia care, so we also cater for people specifically having dementia.
Now, dementia and Alzheimer's, many of you like me must be using it interchangeably. When someone elderly has forgetfulness, we say, they are growing old, and that is why that's dementia, it's Alzheimer's. We use it interchangeably. Is there, doctor, a difference between dementia and Alzheimer's?
Definitely there is, but I would say I don't want to get too much into the technicalities, because I mean, if you go by research criteria, the whole dynamics have changed right now. But in simple understanding, dementia is the umbrella term.
Okay.
And within the umbrella of dementia, there are different causes of dementia. Now, a huge chunk of the cause of dementia is due to Alzheimer's disease. There are other causes of dementia, like those due to probably a substance like alcoholism, or it could be due to vitamin D deficiency, or it could be due to head injury or trauma. It could be due to Parkinson's disease, which is also causing a memory problem, or not only memory but a cognitive decline. There is also that due to vascular changes in the brain, which is reducing the blood supply to certain parts of the brain, which is again leading to dementia. So there are different causes of dementia. Alzheimer's disease
is
being
just
one of the chunk of dementia.
Okay. Yes. So I did just mention that when someone forgets something, we say they're growing old, it's dementia, it's Alzheimer's. But is there a difference between just regular age-related forgetfulness? I'm sure this is a question on your mind, because it has been on mine. Just regular age-related forgetfulness and Alzheimer's.
So this, in fact, is a very good question, because we see a lot of people coming in or being I'll say they miss the diagnosis of Alzheimer's or dementia for years sometimes, because they say it's in people's minds it is they're growing old and therefore it is forgetfulness is normal. But actually there is a difference in the type of forgetfulness due to normal aging and that due to Alzheimer's. So one of the thing is in normal aging you would forget an experience, a part of an experience. Like for instance, I would forget that what you told me yesterday. We had a party and you mentioned something to me yesterday, and I forgot what you mentioned to me. And then when you gave me some cues or something later on, I would kind of remember it after some time. Possibly it would take me a little time, but I would remember it. But in Alzheimer's disease, I would forget that there was a party only yesterday. So the whole experience of even going for a party, I would forget. Yeah, and then it's very difficult for me to actually recollect later on that there was a party, you know. So the whole chunks of experiences are kind of gone off from the memory, and even after some time, even after trying to recall, sometimes I'm unable to recall. So there's a huge difference over there. The second thing is I'm able to take in written instructions. I'm able to follow instructions in normal aging. So if someone gives me instructions, I'm able to follow them. I'm able to remember my reminder notes. I'm able to use reminder notes to kind of remind me of certain things. But in Alzheimer's, I'm unable to even to follow instructions which are written. I'm not able to use reminder notes at all.
I can read. If a patient has Alzheimer's, can they read and understand what it is, or they can't?
So let's go into what are the various symptoms of dementia, and so how would we recognize whether someone is actually having a problem. So again, it depends on which part of the brain the Alzheimer's or the dementia is kind of affected more. But let's go into more generic symptoms. So again, symptoms are divided into mild, moderate, and severe. Yeah. So if it's a mild disease, not every aspect has gone off. Yeah. And as the disease progresses, more and more damage to the brain takes place, and therefore more symptoms emerge from there. But things like, so it can affect your memory. So as I said, you can forget whole chunks of information. It can affect your ability to, your language ability. So sometimes I can look at this pen, and because my language ability is preserved, I will call it a pen. But someone with dementia may look at this and may not know what to call it. They know that it is a pen, but they do not know what to call it. So they're not getting the word. Yeah. So sometimes they may look at their father, they may look at their son and call him brother. Though in his mind he knows that it is his son, but he will call him brother. So sometimes they use the wrong words.
So that's because of the language problem. I mean, they cannot, their mind is not connecting the words.
Language is getting affected, and therefore they use the wrong words. Yeah. So in terms of forgetfulness also, they may misplace objects. Yeah. They have forgotten that they have said things, so they tend to repeat themselves. They'll say the same thing again and again, and you said, but Dad, you just told me that. Have I? I have not told you that. So they've even forgotten that they have actually spoken the same thing. They will, after their meal, they'll say that they've had a full meal. They say, you didn't serve me anything. Where is my food? And I say, but Dad, you've just had your food. I have not had any food. You're trying to starve me, So then the paranoia starts developing, because actually they have forgotten. They have forgotten that they have kept their keys in a particular place, and they'll feel that you have robbed me. Okay, someone has robbed my keys, and then you'll go hunting, and then you'll find the keys and say, see, I knew it. You were the one only who took the keys, and you've taken out all my valuables. So the memory problems can then lead to behavioral problems. The language problems can lead to behavioral problems in the sense I begin to use the wrong words, I begin to use the wrong sentences, and as it progresses, my whole language, you can't even understand what I am saying then, Then they get disoriented to time, place. So they may be at home, but they think that they are not at home. Yeah, they do not know where they are, and it's a familiar surrounding. They have lived there for a large part of their life, but because of the disorientation to place, and also because of forgetfulness, they go back into the past, and they remember or they think that they have to be living in their childhood home, so they feel that this is not their home and that is their home. Then as the memories start worsening, they go into their childhood, so they begin to say, where is mommy, where is daddy, mommy and daddy are not here, So things like that.
Getting back to the difference, this is just for the audience, what doctor has said, that the difference between forgetfulness and Alzheimer's is that forgetfulness is just parts of an incident that people forget. Whereas in Alzheimer's, they forget the entire incident. Am I right, doctor?
Yes.
That was one major difference that you spoke about.
Yes.
Would you like to add some more differences?
No, that's one of the main thing. And in normal aging with Alzheimer's is the others, where they are able to follow instructions, not able to follow instructions, able to care. In normal aging, they're still able to care for themselves. And Alzheimer's, as it progresses, they're unable to care for themselves. Yeah. So
yes.
Yeah.
And it is very difficult.
It is very, very difficult. And if you go to see, almost 90% of the families have actually lived with someone with a full-fledged dementia, but they have not even diagnosed it. They thought it was just normal aging, and that's where then the abuse starts taking place, because they do not understand that it's a sickness. They think that when he's gone to the toilet and he's passed urine, not on the commode but on the side, he's actually doing it to spite us, you know. So they begin to misread a lot of these symptoms and not only know that it's actually coming from a genuine cognitive decline, a neurocognitive decline, but they begin to read it as, no, they're deliberately doing this to hurt me. They want to punish me. What wrong have I done? And there's so much of that burden, and from there we begin to see elder abuse taking place. And elder abuse is huge in our country. And elder abuse is not only physical abuse, but it can be emotional neglect, emotional abuse. It can be financial abuse, where you actually restrict or cut off the aid given to the person, or you try to take away his money or her money. Neglect can be a huge abandonment. So there are various ways in which elder abuse takes place. Initially we thought it was only physical, but there's in so many other ways. Yeah. And it's very sad when actually some of these can be diagnosed, can be treated. If they're caught on early, there is, we can at least delay the decline. If the decline would take place like in 1 year, we can delay it at least for some more time, with medication, with interventions, which teaching the caregiver the right ways of communicating, the right ways of handling certain situations. And that's what we try to do. We have caregiver support groups. We educate caregivers through that. Caregivers learn from one another, where they share instances, they share how they have actually managed a particular instance. Like for instance, if someone wants to go out because he wants to go home and actually he's at home, how do you deal with the situation with that? So we as professions can give them technical advice, but other families can give practical advice of what has worked for them and what has not worked for them. So that's how caregiver support groups help. By also it's a safe space where they can actually share their emotions and their burdens, what they are going through, and that helps a lot in their caregiving.
And it helps them. It's such a release to talk about it to people.
It is. It is.
And I think we need to have many more of these support groups.
Yes.
I think people who are caregivers, it is not easy. We do understand that. I do appreciate, and doctor does appreciate it. But you have to remember that there is help. But sometimes, doctor, it so happens that the caregivers are so bogged down with taking care of the person who has whatever, especially Alzheimer's. They don't have time to themselves. Now, in countries abroad, I know of a friend who has a child with autism, and the government helps her by giving her 1 day or 2 days every 10 days or every 15 days as a time off.
Yes.
They send someone to the house, and she's a single parent, so she gets that 2 days or few hours time off.
Yes.
Do we have anything like this out here in our country?
At this point we do not. But the good news is that with the new Mental Health Care Act of 2017, there are provisions for this kind of support for people with who have the burden to care for someone with any long-standing with a debility or an illness. So the thing is that the act is there, but the act is not being implemented at this point.
Right.
So in Goa, we've already had 1 or 2 meetings, but I think more meetings are required, and the implementations have to take place. It's going to take time, but at least we know that there are provisions. So that is one thing which is good, and that we are going to be working towards this direction, where it is going to take time, but that is one hope. Till then, what I would really suggest for caregivers for someone with dementia is build in your own support system. because you can't be the primary caregiver forever. So involve other family members. Ensure that, okay, if you're going to do it like on Monday, Tuesday, Wednesday, Thursday, Friday, at least someone else comes into care. Or at least get in a neighbor, someone who can give you some relief for an hour or two, where you can go out and do something for yourself. Ensure that you're not caring by yourself. Number 2 is take care of yourself. Because what happens so often, you're so bogged down with caring for the other person, and you really love that person, therefore you want to care, but that you forget that it's important to
take care of yourself.
To take care of yourself, because it's only by taking care of yourself will you refuel yourself to be an effective That is. Third thing is, find someone you can share and talk about your challenges, because it is not easy. As I said, it's not easy. You are not trained. See, to be a psychiatrist, I have taken years of training to care effectively. To be a family caregiver, you are not. And the worst thing is, as I mentioned earlier, is that you are doing your 100% in caregiving, but that is not appreciated. The person with dementia will often find that you are the person responsible for his problems, and therefore there is this constant back and forth. Because of his confusion and his symptoms, he targets you. He targets the caregiver. Now that adds to the burden of caring. And it's like, as I said, a constant back and forth, a constant battle, and therefore you need someone where you can share what's going on in your life. You can have someone to
a friend or a family,
or as I said, a support group.
You talk about.
A support group. It is so very important that you get respite and you get you get that listening ear for yourself.
Now you spoke about training, and doctor says that the caregivers also need to be trained. However, let me give you an example, a situation. What about those who are poor, and they have a sick person in their family? If they go for a training, it's not possible for them to look after the person, and they have no one to look after the person, and then it becomes that they have abandoned that person, the family member who is sick. So
it is not about poor and rich. It's really not about that. It is whether you have a support system or not. In all communities, in all levels, of socioeconomic backgrounds, some have a very good community, a support system, and some, you may have all the money but you do not have that support, because to get someone into your home, sometimes you have to trust someone else to take care, and you have to leave the home to go for you have to go to work, and then you have to trust your home and your elderly person in someone else's hands. It becomes difficult. So it all depends on the kind of support you have. So right now Cooch has actually developed a model for training, which can happen either you can come to our center and get trained, where hands-on, where through our the senior therapy center you can also get trained, or we can do a training online.
Now with everything shifting online,
so that is also available, where we now train caregivers to be effective carers, because it is not easy at all. It is not easy. And what happens is, as long as they know that they're not doing this alone, that relieves a lot of the burden that someone understands them, what they're going through. That actually helps them a lot to actually further in whatever the task that they have to do. Yeah.
To all caregivers, just to say that I'm sure that you must be doing an excellent job, and it is not easy.
It is not easy. Especially when wandering becomes one of the symptoms, where, as I said, they're wandering in the sense they want to go home. They are at home and they want to go home, and therefore they just open the doors and start going into a direction leading to their house, and then they get lost. So and if you kind of shut all the doors and lock all the doors, then they feel stifled. So there can be aggression coming because they are locked in, and there can be the risk of them losing their way if they're allowed to go out. So if the doors are open. So it is, it's the confusion of how to handle these symptoms. What do I do? Do I lock the door? Do I leave the door open? and that becomes it's a very common symptom. I remember my grand aunt, she had Alzheimer's, and at that time we were living in Calcutta, and she used to go to Mother Teresa's home every day for mass in the morning. And suddenly at like 3 in the morning, she's all dressed up to go to church, and we are saying like, where are you going? No, it's like, I have to go for mass will start in half an hour, and we're saying no, it's only 3 in the morning, and we're holding her back, and she's getting so aggressive. So then all we had to do is at 3 in the morning take her there. She saw it for herself that the mass, so we told her, no, mass is over, mass got over, and I think we reached a little bit late, let's go, and there's another mass which will take you back. So it's important to know how to handle the situation. Sometimes you just have to go with the flow, because the more you resist them, the more aggressive they get. Go with the flow, and then when they see it for themselves, then they are more calm at that time.
Now, you just spoke about that there are times when their symptoms are so bad that you have to keep them within the house, you have to keep them locked, because otherwise, like the same friend who I was speaking about, my neighbor, her mother just used to walk. She used to take her bag, a little handbag, and she used to say, I'm going to the market, and just go. And she used to get down anywhere, and nobody knew where she was. It so happened that she had a few incidents where people called her and said, your mom is here or your mom's there. So what should a person in a situation like a family member do? If I have someone who has Alzheimer's, who keeps walking out of the house, is it okay for me to lock the doors?
So it's a very complex answer. There is no easy yes and no answer for that. There is no easy. We have to see the whole situation. I mean, it's not a yes and no answer over there, because as I said, locking the doors and leaving the person alone itself can be very harrowing for them. And then they're alone and they're confused, they do not know where they are, and then they want to go out, and they can, it can be worse. Right. So there is no yes and no answer for that. We have to look at the support system of the person, and accordingly, come up with kind of solutions.
You had said that, with Alzheimer's, you had said earlier that with Alzheimer's or dementia, the first step is to recognize that there is a problem.
Yes.
What are the things, if I have an elderly person in my home, what are the things I need to be aware of so I can take the next step and get it checked out? What should I look at?
Yeah, so as I said, if the memory is more than, the memory decline is more than what is normal, I said the person is losing full chunks of information, the person is repeating himself again and again, the person is misplacing things more frequently than before, we need that, it's a red flag. If the person is getting more, there are mood changes happening, the person is losing touch with his orientation to place where he is, time, we need to, a red flag has to come up. If the person is not able to use the right words, he's forgetting familiar people who he's so familiar with, his own friends, he's forgetting their names. It's a red flag. So if any of these things happen, we need to get an assessment.
So where does this assessment in Goa? Besides
go to any neurologist, go to any psychiatrist, and yes.
So what are the tests? Like, what are the type of tests that they do? So if I'm taking a family member tomorrow to a neurologist, what exactly would they be doing?
So first they will examine the person. Physically there'll be a whole examination. Then they'll do a full mental status examination. They will check his memory domains, his language domains. They would then there are certain neuropsych tests that are done. Then they'll do a full blood workup, because we also want to check whether there are any reversible causes of the dementia. Yeah?
What can you explain that? What's that? What is
reversible? So a full reversible. So if there's a thyroid problem, or there is an electrolyte imbalance, or if there is low vitamin D levels, or if there are certain drugs in the system which are not which are making things worse, So then accordingly to his whole blood profile, then we will understand that, okay, maybe these are reversible factors which we can correct, the person could get better. We do an MRI scan, a brain scan, so that from the scan again we begin to see, is the blood supply to the brain reduced, compromised? Is there certain areas where there is vascular insults that are taking place? Then if we can correct those, then possibly the dementia can also get reversed. Yeah, but we really can't stop it. Yeah. But then there are modifiable factors again which can delay the whole process. Yeah? So if we can correct those, then yes, we can, there is interventions available. And that's what I'm saying. Knowledge helps, that from an assessment point of view, at least maybe we cannot stop it, but we can delay. We can preserve the quality of life of this person for a longer period of time. And that is so very important.
So there are medications you can.
There are medications that can, and we have to remember that medicines work in the initial stages of the disease. Once the disease progresses to severe form, whatever medicines you will give will not really work. It will help probably symptomatically to reduce aggression and sleep maybe, but really for the disease, then the medicines do not work. So it's important to catch on the disease early on so that we can treat it early. It's important also prevention. I mean, I would talk in terms of preventing dementia. See, there are a lot of people who have risk factors for dementia. I mean, either you've had someone in your family who's had dementia, and that would, increase your risk for getting dementia yourself. So there are certain risk factors which, if we can address them, we can probably delay the onset of having dementia ourselves if we were there. And it's all about, basically it's a lifestyle modifications. It's important to exercise probably. We've seen physical inactivity is a risk factor for getting dementia. The type of diet that we have, they've seen the Mediterranean type of diet is actually is very good for our brain. But our diets need this kind of modification. We have too much of red meats in our diet, too much of oil, too much of high fat content, too much of sugar, too much of salt. These things can actually worsen our brain
So what
function.
would you say is an ideal diet?
So it's a balanced diet where we don't eat too much of anything, and that's very important, So not too much of, in fact, restrict the whites, restrict your salt, restrict your sugar, restrict the fats in your food, restrict the red meats in your food. Alcohol is a huge risk factor for dementia. So I'm not saying stop alcohol, but don't over drink it. Keep it to your 12 units a week, which is kind of permitted and acceptable. Restrict. It's important to challenge your brain. Live an active lifestyle. When I say challenge your brain, keep reading, keep puzzles.
Do they really help? Because I read somewhere that they don't really help. We say that crosswords and puzzles and find the difference, all the different games that I like playing, and they say it doesn't really help. That is Google.
Yeah, it does not help what? When you say does not help what?
Getting Alzheimer's or
if you have to get Alzheimer's, you will get it, but you will at least delay it. The main thing is, because the more you challenge your brain, the more you're improving the neurons, the number of neurons in your brain, and the connections between the neurons. You're preserving it. But definitely, if you have to get dementia, you will get it, but at least you can delay that process. Learning a new language is one of the best ways of actually improving the nerve connections in your brain. Research has shown that if the lack of education is also a huge risk factor of dementia. Though education is actually helps to preserve it, so that is important. Then they have seen diabetes, air pollution. Pollution is a huge risk factor for dementia. So if we can control these risk factors, and a lot of them actually modifiable. Just living a healthy lifestyle, add exercise, social connect is so important, because that actually again improves your connections within the brain, and that helps to preserve your brain function. So if we can just work on these risk factors, then even if we have to get Alzheimer's, it will be delayed and the decline would not be as fast.
But what is the act exactly? Can you just in a few lines explain to us what it is all about?
See, the act is more progressive in the sense it is more client friendly, not really family friendly, but client friendly. So it looks at the needs of the client and looks at it from his lenses and what he requires. So that is one thing which is very good, and therefore someone with Alzheimer's needs a caregiver to come to his house and look after him. The act kind of provides for that. But again, it's an act that needs a lot of finance, a lot of budget, and a lot of, besides the finance and budget, a lot of systems to be in place,
put into place,
and a lot of changes of the mindset that needs to take place from everyone. So though the act is very progressive, it will take many years to actually fully implement it. But as I said, I'm very happy that this act is there, which gives provision so people can fight for it now. So you can look at it from a top-down approach, but you can also do it from a down-up approach, where families who are going through it can get together and actually ask the government what's happening. Why is this not being implemented?
Has anyone done that so far? Because
we need to do it.
Because I'm sure many of you weren't aware of it.
The Psychiatric Society of Goa, as a member and as past president, we have had a lot of awareness programs on the Mental Health Act at different areas of Goa. So we have done these steps from our side. But yes, a lot more awareness needs to be done. Yes, that's there.
So people can utilize, the government has made some provision, we can use it.
And we look at one is from the Mental Health Care Act, but we also look at the other act of the Maintenance and Welfare of Parents and Senior Citizens of 2007, which is also there, which also looks after the general needs of the elderly and prevents abuse in the elderly. So if we can work at it from various angles, but if you look at support systems and care homes for people with dementia, specifically in Goa, there is nothing, though a lot of senior homes do take in. But as I said, the burden of care for normal elderlies is already so high. Now to look after someone which has special needs is a lot more difficult, and they really do not have all the resources in place to look after this. So, because of this lack of facilities and the burden of care, this could be one of the reasons for elder abuse in our state.
You spoke about, keeping the elderly involved, keeping them active. So you can delay, if there is Alzheimer's coming, you can delay the progress of it. But how do we keep our elderly engaged? They have retired, some of them have just been looking after their home managers as such. They have been at home, and now as they're growing older, they cannot do the normal activities that they used to do. So how do we keep them involved?
So it's important to find the skills that they are still good at and work on them and give them activities that would help to continue and preserve those skills. Also teach them newer skills. So what, and this is actually Cooch has just won an award which we will be getting on the 27th of August. It's an award which is an organization in Switzerland has kind of awarded us, where through this award amount we are going to now set up a pilot project where we will be teaching the elderly people to use a tab. So first of all, many of them, so by using this tab, they will learn a new device. So again, learning takes place. The second thing is the tab will help them now to be in connect with other people. The third thing is they can use the functions of the tab to help themselves, like various games, neurocognitive games that can be installed into the tab, and they can use those games. So again, what I'm saying, this is our project where through this digital divide, it will help to reduce the digital divide, help them to use a new device and get the benefits of using a tab. So, at our level at home, whatever we have, we probably have a pack of cards.
Yes.
Teach them patience. Teach them how to play patience.
But for that, you need to have patience yourself.
You need to have patience. But see, it's all about the motivation. You have to find the things, and some of the things are inexpensive. They're simple things which can be done at home. Your elderly at home have to feel useful, have to feel a useful member of that family.
Exactly.
So you just don't say, give them coloring books and say, now color. No, I mean, for what? Why? I'm not a kid. But give them an activity which will help them to then get a product which can be used in the house, and then they will feel useful. So even if it has to be coloring, say, Mom, we want to make cards for Diwali, so can you help me? I will make a few cards. Can you do? Can you make another few cards?
Okay. So they feel they're contributing.
They're contributing, and it's not the demeaning by treating me as a child.
Yes.
So that is so important. The intention has to be when you're giving them an activity, the intention, and for them it should be that they're contributing. It can be as simple as taking your old dupattas or old cloths and making, just plaiting them and then making rugs out of them. Mom, we want to make rugs for Christmas or Diwali. So can you help us to do this? So they'll feel, I would love to do it, So again, they're contributing. So it's important to find activities that will help them to actually contribute in the family and feel a part of the family and feel loved and useful.
This is for people who can do things with their hands. How about people who are not able to physically do small, simple activities? Is there anything that we can do there?
See, I believe that there is nobody who cannot do anything. Everyone can do something. We have to find
that.
We have to find. And there is no clear-cut answers to your questions, but it is through a process of trial and error that we'll figure it out, what can be done. Like we do dance therapy for someone who is on the bed. Yeah, because somewhere, if they cannot move their hand, they cannot move their leg, they can move their eyes. Yeah, probably they can move their neck and they can learn to rock to the beat,
Yes.
Just move their head to the beat. So there is something, we need to want to do it. The desire has to be there from our side, and if the desire is there, we will find something that they can do in their time.
As a society, what can we do in this area, either by ourselves or as a group? Is there anything that we can do, some initiative that we as people can do?
I think the first thing is to educate ourselves. That is the first step, because if there is lack of awareness that there, and why we need to do this is so important is because India is an aging nation.
It is.
The number of elderlies are growing exponentially, and with the numbers, like right now we have around 100 to 150 million elderly people above 60 years, but this number is going to change. It's going to go to almost 325 million people. This is because our lifespan is increasing and the infant mortality rate is reducing. Therefore, the number of elderly and definitely our health systems are improving. So we are going to have an explosion of older people. Along with the numbers of older people, we're going to have the numbers of people with Alzheimer's and dementia is also increasing exponentially. It was like 4.1 million a few years back. It's already reached around 6.3 million, and another few years is going to go up to 13 million. So the numbers are rising exponentially. It is like how we are preparing for the third wave.
We need to prepare for this as well.
We need to prepare for the older people that are going to have not only dementia but a variety of mental health issues. And we need to equip ourselves. I think the first step of equipping ourselves is awareness, to know that there is an urgency also for this. And the third thing is reach out to someone reach out to your elderly. Keep them socially connected. Visit them once in a while. Make a phone call to them. These are simple things, but it goes a long way in changing the way they feel. And then when they feel better, they actually will perform better.
And you'll have stronger
networks,
family relationships
and yes, definitely.
And you make better memories, Doctor.
Volunteer and organizations. In fact, our senior therapy center runs because we don't have that much of funding, but it runs primarily from the community, volunteers in the community. And volunteers come to our center, they take online sessions, because some of the sessions are very simple. As I said, it is cognitive games, singing, movement therapy. In fact, we're having a program next week where we're having a dance therapist from Bombay who's going to conduct an online session on movement and dance for the elderly. It's a 1-hour session. So get in, volunteer at organizations, volunteer to go and help your neighbor who has someone with dementia, maybe, to give him that respite for an hour to where he can go out, just take a walk, take a run, go meet a friend, just give him that time off once a week.
True.
Just volunteer. So that as a community, we can build a base of supporters, people who actually care for someone who is elderly.
Right.
Yeah.
So that was all from us. And as doctor said, we all need to do our bit. A smile, a kind word from you can make a major difference to an elderly person. And remember, we're all growing old. What's happening just now to the elderly can be changed by you and by me. Doctor, thank you so much for coming on our show. We've learned a lot, and I hope after listening to you, there will be many viewers who will call up Cooj and volunteer. So thanks again.
Thank you for having me, and thank you for discussing this topic, which is so important.
Not at all.
Yeah.
It was our pleasure. We've learned so much. So till next time, everyone, take care of yourself. Thank you for watching. Bye-bye.